Hey folks, my name is Mo Amir and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. Tonight we're going to focus in on healthcare issues. Tamara Taggart will be here to discuss BC's decision to become only the second province to remove mask mandates in healthcare settings. But first, I saw the Super Mario Brothers movie on opening weekend. Great film, by the way. And before the previews, they played this ad for Ozempic. You know the one. Ozempic. It's a drug that treats type 2 diabetes. Now, I had heard of the drug before because celebrities, influencers, and even billionaire trolls like Elon Musk have touted Ozempic as an amazing weight loss drug. And then last week, Canada's health minister, Jean-Yves Duclos, acknowledged that there was a mass export of Ozempic from BC to the United States. Literally 17,000 prescriptions written by one doctor were filed in BC pharmacies and mailed to the US. But some folks, including doctors who prescribe it, are saying that Ozempic is popular for the wrong reasons. Here to discuss is an obesity medicine physician who prescribes Ozempic to her patients. Founder of Best Weight and High Metabolic Clinic, she is Dr. Sasha High. Dr. High, hello, and thank you for being here tonight.
Thanks so much for having me, Mo. Appreciate it.
Absolutely. So you just wrote a piece in Maclean's arguing that Ozempic, a drug that you prescribe, is popular for the wrong reasons. What do you mean by that?
Yeah, it's gaining popularity as a quick fix for those who want to lose weight. It's being discussed in Hollywood a lot for aesthetic purposes. And, I have to say that I think that it gaining popularity has some benefits to it because people who would benefit for medical reasons are becoming more aware of Ozempic and how it may be able to benefit them. But certainly our discussion around using it as an aesthetic drug is that's where I would say, it's gaining popularity for the wrong reasons.
I mean, is there any harmful effects for using it as a short-term weight loss solution?
Well, it's neither a short-term solution, nor is it a quick fix for weight loss. And so I think it's just being used for the wrong purposes. So I'm an obesity physician. This is a medication that is a useful tool for people who have either type 2 diabetes or obesity, both of which are chronic medical conditions. These are diseases that have physiology that warrants treatment. And Ozempic is a medication. The other name for it is semaglutide, and semaglutide is a very good medication for treating diabetes and treating obesity, but it's not used as a short-term quick fix option. It is used to treat chronic conditions in a chronic manner.
I guess what I'm getting at is, could it be dangerous if someone is taking Ozempic, but without the proper guidance or perhaps even the necessity to be taking this drug?
Well, number one is it hasn't even been studied in this population, right? So it hasn't been studied in people who don't have diabetes or obesity. So we don't know. We don't know what it could be doing in people who are just using it to lose the last 5 pounds or fit into a size 2 instead of a size 6. So that's the first thing. The second thing is there are side effects associated with this medication. Generally, they are fairly mild GI side effects that can be well managed when the medication is used in a supervised fashion by a medical professional who knows how to prescribe these medications. I think that there are bigger risks, like the effects of weight cycling long term. So we know that people who weight cycle, that has detrimental effects on cardiometabolic health long term. It can make it harder to lose weight in the future. And so if we're using it as another thing that causes short-term weight loss only to then cause weight regain because people are not using it appropriately, they don't realize that this is a long-term drug, that's going to cause, I fear that could cause issues, 10 years from now for the people who are using it as a short-term solution. So, I think there are a number of factors to consider here.
Now, from your vantage point as a doctor who does prescribe this for people who need it, is the popularity of this drug perhaps creating shortages for people who need Ozempic the most?
There have been periods over the past 6 months where people were having difficulty getting access to the medication. And so they would go to their pharmacy and they'd be told they're only allowed, the pharmacist is only dispensing 1 pen because they had shortages. There was a period where certain doses of the medication were not available. And, you know, it's in part due to the rising popularity and the example that you gave of, you know, the exportation to the United States may be a concern. There's also just supply chain issues that have come up over the past year. And so the manufacturer is working on that as well. So I can't pinpoint it on one thing causing the, you know, some shortages. Fortunately, those have been rectified fairly quickly. And so we haven't heard about it in the last month or so. But, you know, the concern is if we're losing the medication in Canada to people in the States, is that going to cause supply issues for Canadians who need this medication? And it's possible. We don't know. It's playing out right now as we speak.
So let's talk about that for a second, because I've seen estimates that in January and February of this year, up to 15% of BC's Ozempic prescriptions were actually exported to the US. So how did BC or Canada become a large exporter of this drug, of Ozempic, to the United States? Because presumably you can get a prescription and purchase Ozempic in the US as well, right?
Yeah, so this is a great point. So this goes to bigger issues of, you know, medication access globally. Ozempic in the United States on a monthly basis is about $1,000, right? So for people who need this medication and don't have some private insurance plan, or their private insurance plan won't cover it because there's still a lot of bias. So let me give you an example. People with obesity who would benefit from using Ozempic as an anti-obesity medication, but they may have an insurance provider that thinks obesity is still a lifestyle choice, and for that reason will not provide coverage. So they're in a position where there's a drug that can treat their disease, but it's $1,000 a month. That is a whole lot of money. In Canada, because the government, you know, puts restrictions on the cost of pharmaceuticals, you can get Ozempic for about $230 a month. So I'm not surprised that people are coming across the border to try to get their prescriptions filled.
Now, ultimately, I know you're not a policymaker, but does Canada need to clamp down on exports of this drug, and maybe even who this drug ultimately gets prescribed for?
I mean, I think there's a few things here. There's the clamping down on exports of the medication, but there's also, you know, one physician prescribing 17,000 prescriptions. There is just no way that that is appropriate prescribing where a medical, you know, assessment was done and risks and benefits were discussed with the patient. Like, it's just not possible. Right? Mm-hmm. So it's not only it's regulation of pharmaceuticals, but it's also regulations on physicians providing proper medicine.
Well, hey, Dr. High, I appreciate your time tonight. Thank you so much for unpacking this controversy around Ozempic. And by the way, are you a fan of that jingle? Did I do its justice?
I was going to say, it's going to be stuck in my head now. I'm just going to be like humming it all night now, right?
Well, I apologize for that, but I thank you for your time tonight.
Thanks so much for having me, Mo.
Absolutely. Folks, that was obesity physician Dr. Sasha High. Make sure you check out her podcast, High on Life, and find more about her work at www.sashahighmd.com. Now sit tight, because we're going to fire up the kettle and talk about how we feel about BC being only the second province in the country to remove the mask mandate from all healthcare settings. Tea Time with Tamara Taggart is up next.